Hello everyone, my name is Equasia Williams and I'm a nursing student in the RN to BSN program at Lamar University. Today, we will be talking about disaster preparedness safety tips for pregnant teenagers. When an impending emergency arises, many people simply aren't prepared. Most of us think it's not going to happen to us. Currently, Hurricane Matthew has made its way along the East Coast. It's killed over 800 in Haiti and about 10 in the U.S. We live along the Gulf Coast in warm waters, and a hurricane can happen at any time. I've been a victim of about 3 hurricanes. I've evacuated twice, and it was absolutely stressful. Think about it. You're young. Some of you may have jobs, some may not. Some of you may live with your child's father or still at home with your parents. Either way, funds are low and you just don't know what to do. You don't know which way to turn. So being prepared is the best thing. Making plans ahead of time and knowing what to do when a disaster occurs can help you be safe and keep baby safe. Upon completion of this presentation, the aggregate will be able to identify signs of preterm labor, demonstrate effective hand hygiene techniques, and make a list of resources that are available to the people for help. It doesn't matter how far along you are in your pregnancy, preterm labor can happen at any time. Being in a disaster is so stressful, and baby can decide, I'm coming now. Whether you stay at home or evacuate, you need to have a first aid kit. You also need to have an emergency birthing kit, just in case you aren't able to make it to a hospital. Your emergency birthing kit should have things like clean towels, scissors, a bulb syringe, which is this. You use this to clean the baby's airway. You make sure that baby can breathe. You suction out mouth and nose of the infant. You also should have things like 2 pair of shoestrings. Once you cut the umbilical cord, you use a shoestring to tie each end. So one is tied to mother and one is tied to baby. Here, on my poster board, I have signs of preterm labor. Signs of preterm labor: menstrual-like cramps, low, dull, or sharp backache that may come and go or may be constant, pressure that may be felt in the pelvis, abdomen, or thighs, abdominal pain with or without diarrhea, increase or change in vaginal discharge, any leakage that may be watery, pinkish, or bloody, fluid leaking, which may feel like urine that you can't control, 6 or more uterine contractions in 1 hour that may be painless, tightening, or balling up, feeling lousy or flu-like feelings like something just isn't right. Anytime you have any of these symptoms, call your doctor or make it to an emergency room the best way you can. Next is hand hygiene. Hand hygiene is very important. Sometimes in an evacuation, you may have to go to a shelter. In those shelters, they're crowded with people that are coughing, sneezing. You have to protect yourself at all times, even if it means wearing a mask. Make sure that you wash your hands as often as possible. Use warm water, soap, lather your hands up, wash all sides. Any visible dirt, make sure you get it off. Make sure you clean under your fingernails, So many germs are under your fingernails, so make sure you clean under them. Here on my poster, I have 8 steps of hand washing. Number 1, wash the palms of your hands, which is the inside. Number 2, scrub each finger and in between the fingers. Number 3, rub the back of the hands and in between the fingers. Step number 4, rub the base of the thumbs. Number 5, the back of the fingers. Number 6, scrub your nails on the palms of your hands. Number 7, wash your wrist. And 8, dry hands with a clean towel. Make sure that towel that you use it to turn off the faucet after you finish washing your hands. You can also use that same towel to open the door. The faucet and the doorknob has so many germs. Think about it. You just walked in. You didn't wash your hands before you walked in, and the person before you may not have washed their hands at all. So make sure you use this to protect yourself from more germs. The same way you hand wash, you can use hand sanitizer. Hand sanitizer is the next best thing. Even if you have to use it more than once, use your hand sanitizer, wipe your hands and make sure they're clean, and then use the hand sanitizer again. Here, I have hand sanitizer. Make sure you put a good amount inside of your hand. Rub your palms together, back, front, in between the fingers, thumbs, and you can even get along your wrist. Make sure you rub it until your hands are completely dry. Lastly, each person that's pregnant has a different situation than the next. One of my aggregates has preeclampsia, which is high blood pressure during pregnancy. So she needs to be monitored as often as possible. She needs to make sure that she has her medications with her. One of my aggregates' baby has a low weight, so she's receiving ultrasounds every week to keep up with the baby's weight. In a disaster, you need to be prepared ahead of time to know where clinics are where you can get this type of help. Here, I have a list of crisis pregnancy centers. I got this list from lifecall.org. On this list, it's not only centers in Beaumont, but it's centers all over Texas. So no matter where you evacuate, if you have this list, you can call ahead of time and let them know that you will be arriving and that you may need assistance. There's things called Birthright, Hope Center for Women's. There's also Family Nursing Partnership. All of those organizations, you can contact them and get a resource list ahead of time so you can be prepared in the event that you do need help. Along this list, you can go out and you can pick out whichever is best for you. There's also Ready.gov, the American Red Cross, Texas Food Bank, 211, Human and Health Services. Any of these resources you can call. Nowadays, everyone keeps up with the internet. You can get on Facebook, Twitter, you can see what's near you, you can use Google. Oftentimes, in a disaster, cell services aren't available. But the point of being prepared is having these lists made ahead of time. Mothers, make sure you have things like diapers and wipes. Bring it along with you. If you know that you're close to delivery, make sure you have your car seat. If you're going to use formula, make sure you have clean bottled water for a baby. That's the safest way for you to make their formula. Another thing that you can use is breastfeeding. Breastfeeding is the most cost-effective thing that a mom can do for her baby. It also provides good antibodies for the baby that'll protect them against all the germs that they're around in this unhealthy environment during the disaster. So make sure you have your list prepared. Make sure you have an evacuation route. Make sure you know who you're going to be with and who to call. Any disaster, you need to know all of these things ahead of time. I have a pamphlet here from the March of Dimes, and it states, "Are you ready?" It has things like getting ready before a disaster, plan your emergency supplies for infants and for in case there is an emergency delivery. It also has during and after a disaster, and of course, again, signs you need to know for preterm labor. You can take this pamphlet home with you guys so you can be aware of everything that you need during an emergency. And as my sign says, are you ready? I hope this presentation helped you ladies a little bit on learning things for disaster preparedness. Make sure that you have a plan. Make sure you have the things that you need for mother and baby. The ultimate goal is safety for you guys. Safety, safety, safety.